Hello everyone! In this video, we are going to completely decode GCS, which is Glasgow Coma Scale, and GCS minus P. Yes, you heard it right. It is GCS minus P and not GCS-P. Now, what if the patient is intubated or has an eye bandage? So wait till the end to master this. Now, what exactly is GCS? It is a clinical scale which is used to assess the neurological state of a person with any kind of trauma, brain injuries, or impaired consciousness due to conditions like hypoglycemia or if the person is terminally ill. Now, GCS tells us two important things about a patient. But first of all, have a look at this ambulance picture. What do you see? Which number is written on it? EVM456. This is the important factor. So, whenever there is any accident or trauma, the patient is taken to the hospital via this ambulance. So, that will help you remember that the ambulance has this number EVM456. So, what does it mean? Let me decode it for you. E means eye response, V means verbal response, M means motor response. Now, the each components are given a highest score and a lowest score. I has a highest score of 4, verbal response has highest score of 5, motor response has highest score of 6. Now, as you can see, the lower we go, the prognosis becomes poor. So, the one decoded in green color means the highest scores means good prognosis. But the lowest ones, the score 1 in every component means it has a bad prognosis. Now, how to calculate the maximum GCS? So it's very simple. You add the highest scores of each components. So E is 4, V is 5, M is 6, which gives a total of 15. So the maximum possible GCS is 15. Now, one trick here for you. This 5 in Roman numbers is also written as V. So here it is. Now, so we understand that GCS says two things about a person. First of all, the prognosis, okay? The greater the score, the good the prognosis, the lesser the score, the bad the prognosis. Second, it tells us about the traumatic brain injury classification. Means mild traumatic brain injury has a GCS of 14 to 15, moderate has a GCS of 9 to 13, and severe brain injury has a GCS of 3 to 8. First is the eye-opening response, where the highest score 4 means the patient opens their eyes spontaneously. For example, a patient is brought to you and the patient is already looking at you. Score 3 means to speech. For example, if the patient is initially not looking at you, but then you call out their name or say, example, hey, can you hear me? And they open their eyes. Score 2 means to pressure. When you apply pressure to their nail bed using a pen, etc., and only then the patient opens their eyes. Score 1, no matter how much you shout or how much pressure you apply, the eyes stay closed. Now I have a trick for you which you can use. Here, what do you see? These highlighted letters in black. Okay, so let's write it down. So first I will write E, which stands for eye, and then S, S, P, and N. So it kind of sounds like ESPN, which is the sports broadcasting channel. So whenever you watch sports, what do you use? Your eyes. So you use your eyes to view it. So that's how you can remember ESPN for eye-opening response. Next is the verbal response. Here we check how the patient is communicating with us verbally. For example, score 5, which means the patient is well oriented with time, place, and person. For example, if the doctor asks to the patient, where are you? And the patient says, I'm at the hospital. That means he knows where he is. Score 4 means the patient is confused. Example, the doctor is asking him, where are you? He says, I think I am at home. So he can complete the sentence but he doesn't know where he is. Score 3 means inappropriate or random words. Means here the patient can't even complete a sentence. He just says few words like bus, apple. Okay? Score 2, which means incomprehensible sounds, means it includes moaning, groaning, or mumbling. Here, not even words are formed, so the patient might reply to you like, hmm, ooh, like this, okay? And score 1 means no response at all. Next is the motor response. It is the most important neurological predictor of the patient's outcome. It tells us how well the brain is communicating with the body. Now, first is score 6, which means obeys command, which means if you ask the patient to raise their right hand, they do so. Score 5, which is localizing. For this, first let's look at the picture. Now, if the patient is unable to follow your command, then you apply pressure on these areas. What are these areas? First is your supraorbital notch, next is your trapezius pinch. You can also do sternal rub as well. So, on giving the pressure, if the patient tries to push your hand away, that means they can localize the pain. Now, score 4, which is flex to withdraw from pain, which means that they don't push your hand away but they flex their hand in response to the stimulus given. Now, score 3 is the abnormal flexion, which is a sign of deep brain injury, and here the posture is known as decorticate posture. Then, score 2, which is abnormal extension in response to the stimulus, and here the posture is known as decerebrate posture. So, now what is the difference between decorticate posture and decerebrate posture? In short, in both of these, there is one similarity that in both of these postures, the lower limbs are extended, but in decorticate posture, the upper limbs are flexed, whereas in decerebrate posture, the upper limbs are extended. And finally, score 1, where there is no response even after giving maximum stimulus. Now, in some conditions, when the patient is intubated or has an eye bandage or has a severe eye swelling, what do? We usually write NT beside the component which cannot be measured. NT means non testable, it cannot be tested in the patient. Now, what is GCS minus P? Well, since 1974, we have been using the Glasgow Coma scale. But in 2018, some researchers realized that something was missing, which was like a window to the brainstem. What was it? The pupils. And that's why now we have the GCS minus P, which is simply GCS minus the pupillary response. To understand the pupillary response, let's see at the picture. In the picture number 1, we see the normal condition of the pupils. In the picture number 2, when the light is shown on one pupil, we can see that there is constriction of both the pupils, which is a normal response, which means that both the pupils are reactive to light. On the basis of this, we have a table over here. You can see on one side we have pupils or pupil unreactive to light, and on the other side we have a score assigned for it. If both the pupils are unreactive to light, we give a score 2. If only one pupil is unreactive, we give a score of 1. And if none of the pupils are unreactive, which means both the pupils are reactive, we give a score of 0. Now let us understand this by taking an example. Suppose I give you the GCS of a patient is E2, V2, M4 and both the pupils are unreactive. Both the pupils are unreactive to light. Okay. So first you need to find the GCS. So GCS will be 2 plus 2 plus 4. You can see the values here. So which becomes 8. Okay. Now let's calculate GCS minus P, which is your GCS minus the pupillary response. Here the GCS is 8 and as because both the pupils are unreactive, it gets a score of 2. Okay. So now 8 minus 2, so the final answer is 6. Simple. Now before we finish, let's see if you have mastered the GCS minus P. So pause your video right now and please write down the answers in the comments below. Thank you so much for watching till the end. Your support really means a lot to me. So if you really found this helpful, then please do like, comment and subscribe and do let me know what you would like to know next. For now, stay healthy. Bye bye.